One of the biggest myths I still hear, even from other holistic doctors or providers, is that allergenic foods should be delayed or introduced one at a time, days or weeks apart. Hi, I'm Dr. Erica Crumbeck. Welcome to NatPeds Pro, where we break down evidence-based research and whole body approach to pediatric care. This channel is for healthcare providers looking for clear, research-backed insights into treating pediatric patients with confidence. Don't forget to like and subscribe. Let's get started. When I was in school, what I learned was that we were supposed to introduce solid foods. That means complementary foods, so not just breast milk, but introduce solid foods to infants waiting at least 6 months. So the thought was, babies don't have the ability to digest food protein particles or solid foods really in general until at least 6 months of age. And the prevailing theory at that time was to actually wait on introducing potentially allergenic foods as one of the last foods being introduced. And what I had learned at that time was wait until 6 months and then only introduce one food at a time. And then by introducing one solid food once at a time, you could identify what the child was sensitive or allergic to by sort of again, having it be really a structured intervention. The evidence has completely changed about this, and the biggest study that was that came out several years ago was called the LEAP study. This is it's called LEAP because the acronym stands for Learning Early About Peanut Allergy. It was a landmark study that really controlled for when children were exposed to peanut products. They also studied egg products. And what they found was that infants who were at the highest risk of peanut allergies, especially those with severe eczema or egg allergy, were identified, and then they were randomized to either avoid peanut exposure or to consume early peanut products very early. And what they found was that early introduction to peanut products actually reduced the risk of severe peanut allergies by 5 years of age. This study and many other studies have actually confirmed very strongly that actually early solid food introduction is associated with a reduced risk of severe, serious food allergies with infants. And it's frustrating to me to continue to see alternative medical providers or naturopathic doctors advising patients to wait and then introduce the foods one at a time, which we really have no evidence for. So I'll backtrack a little bit and talk about why I think that this is happening. This idea of wait, and then this magic day arrives of 6 months, and then all of a sudden it's game on, let's feed babies a whole jar of baby food. If we just think about it sort of naturally and rationally, it doesn't really make a lot of sense anyways. So it's waiting and then sort of overexposing the system to one food at a time, which is actually the most likely to create an allergen. We're overwhelming the immune system with that one food at a time, rather than kind of, spacing it out. So the other way of recommending foods, I think, is a better way, and that is to introduce smaller amounts and earlier. This is the other kind of issue I have with a lot of naturopathic physicians, kind of old school naturopaths, traditional naturopathic practitioners, or holistic practitioners who advise waiting until 6 months of age. Actually, historically and globally, very few societies introduce foods that late. Most societies have introduced solid foods between 4 and 6 months of age, kind of on the later end. Some traditional societies actually introduce solid foods as early as 6 weeks of age. And of course, they're not feeding babies, whole jars of baby food. They're just giving, babies or infants these just little tiny tastes. So to go back, how I typically recommend solid food introduction in my practice is, very different than how I learned. I consider the age 4 to 6 months to be the tasting window. So we're not looking at really consuming large amounts of food at that age. What we're really doing is just introducing the taste, the little bits of food, while the baby hopefully is having some breast milk. And that helps introduce tolerance. So that's allowing for these small amounts to enter the bloodstream and for the body to decide, oh, actually, that looks good and that's safe. As opposed to, again, waiting and then sort of slamming the system with everything at once. The other reason I like this is it allows for the digestive system to get used to little bits of food and start making digestive enzymes in increasing amounts. So the digestive system also is getting ready for this. This tasting window of 4 to 6 months, the baby really isn't consuming they're not consuming a lot of calories for that amount. We're not looking for the babies to get extra calories in any substantial amount between the 4 to 6 months of age. The purpose of introducing foods between 4 to 6 months of age is to reduce the risk of true food allergies or eczema. When we're after 6 months of age, that's when we kind of go into phase 2 of solid food introduction. That's when we're really looking that babies first have the oral development to be able to tolerate solid foods. So I often have families trial that. I usually say, start just once with purees, and that's just to assess food readiness. So basically, mom or dad or parent or caregiver puts a little bit of puree on a spoon, puts it on the baby's mouth. If they immediately do, then that's the tongue thrust reflex. That is what babies do to nurse at the breast. They thrust the tongue outward. And what that means is if you put solid foods into that oral cavity, they are just going to spit it back out again. That baby is not ready to move on from tastes of solid foods. That baby still needs a little bit of practice. What we're looking for is you put the little bit of food on the tongue, this is the tongue, and the tongue goes up, down, backwards, sideways, around. They can't quite figure it out yet. Some of it might come out, but some of it's getting moved around, and then eventually the tongue is going to push the food to the back and swallow it. So that's really important. And then with that, usually I only recommend families to do that once or twice. Once they show that the baby is ready for solid food introduction, we can actually go straight into baby-led weaning. And baby-led weaning does not mean weaning the patient from the breast. All it means is that we're moving on to different types of solid foods. Parents are often pretty stressed out about this process. We say give the baby any non-chokeable food and kind of let them figure it out. And there can be quite a bit of gagging involved, again, as that tongue is working out what direction to put food. But what's interesting is that in many cases, babies are actually less likely to aspirate, that means like breathe in their food, when they feed themselves than when the parents feed. So, if this is the tongue, I'll put it this way, if this is the tongue, they put the spoon in, sometimes they put the spoon in on top of the tongue. And so there's really no place for it to go other than back. And so that can be a risk for the baby aspirating food. When the baby puts food in themselves, they usually put it at the tip of the tongue. And so then it has to move all around and then swallow. So usually the babies will gag or just spit it out if that piece of food is too big. The downside to baby-led weaning, though, is, parents thinking that their baby is choking because they're gagging a lot. They're moving that mouth around a lot. And so I think that can be sometimes stressful to parents. But I still think that eating that way is a much better way. One, the babies are learning that great eye-hand coordination. So they're usually starting with that pincer grasp at 6 months, picking up the one Cheerio at a time or whatever alternative, the one smushed black bean or the sweet potato fry that they gonna grab with their whole hand and then shove, usually missing their mouth for the first couple of months of life. Pretty funny. I have a pretty strong memory of my own son very carefully grabbing one pea, and it took him so long, and then by the time he got to his mouth, he had dropped it. You're like, it's pretty funny. But what they're doing is they're developing their eye-hand coordination and that pincer grasp, but while they're also developing that oral control. At first they might be, sorry, I said pincer grasp first, but usually it's actually their whole hand first. They're just smashing objects in their hand and then shoving it in. And then usually around 9 months, they're actually doing the pincer grasp and grabbing one thing at a time and putting it in, which is a little bit easier for them to control. So that's really important. And then the mouth is developing all that oral control. We're also desensitizing the baby to the taste and texture of food, which is really important for babies like long-term just growth and development. Babies who are fed just a homogeneous puree might not tolerate the textures or smells of larger, chunkier foods when they're exposed a little bit later. So there's really not much reason to do purees long term. I find that especially breastfed babies tend to prefer feeding themselves a lot, or tend to prefer using whole foods or similar looking foods to what is on their parent or sibling plate. And then the other thing that I really want to mention is foods that I recommend early. I strongly recommend iron-containing foods very early in this process. So babies, iron is, there's very little iron in breast milk. The amount of iron that is there is very easily absorbed, but there isn't enough to carry babies through for the first year of life. The majority of iron that babies have is actually stored up from the last few weeks of pregnancy. So babies who are born even slightly preterm, or like we'll say late preterm, those before 37-week babies, do tend to become significantly iron deficient. And the more premature the baby is, the less likely they've had really any iron stores at all. So those babies, even a normal term baby by 6 months of age, has typically run out or almost run out of their iron stores that they've had from birth. So we want to be introducing iron-containing foods very quickly. That's pretty much right away at 6 months. Again, it doesn't have to be a lot, but I do recommend at least a couple times a week of iron-containing foods, starting at 6 months. And then usually by 9 months, babies are eating quite a bit more. So we'll have, at least one of their meals about once a day have iron-containing foods. That could be meats, black beans. It could be some greens as well, but you have to eat quite a lot of greens to really get enough iron. So let's talk a little bit about how to counsel our patients through actually introducing solid foods and doing introductions of solid foods to reduce the risk of true solid food allergies. So again, in my practice, I typically recommend babies to have what I call just tastes. I call it the tasting window between 4 and 6 months. I literally just have parents dip their finger into anything that they're eating, any and everything. The only exceptions to that are honey and corn syrup for that risk of botulism. But really, it could be, families having a steak, they could rub their finger on the steak and put it in the baby's mouth. If they're having a soup or stew, just dip the spoon in and hand it to the baby, or put it right in the baby's mouth. It works really well. So that's what I typically start with. I do have families make sure to include the top allergens, especially peanuts, eggs, dairy, gluten. Other tree nuts are really important, and shellfish. And include those as tastes throughout this tasting window. What I often tell families is if by 5 months of age the baby's really eager and looking like they're really ready, they could start to progress to maybe spoon-sized portions of solid foods.